An outbreak of Hantavirus has been reported on the Netherlands-based cruise ship MV Hondius in the Atlantic Ocean. At least 3 deaths have been confirmed so far, while several others have fallen ill. The situation has raised international concern. However, the World Health Organization (WHO) has clarified that this is not a global pandemic like COVID-19 or influenza. Instead, it is a localized and contained outbreak. WHO infectious disease expert Dr. Maria van Kerkhove has said that Hantavirus spreads in a different way and is typically transmitted through close and prolonged contact or exposure to contaminated environments. She added that the current situation remains limited to a specific cluster. On the 2nd day of May, the first case of respiratory illness was detected on the ship. Following this, Hantavirus was confirmed in several passengers. Those in serious condition were evacuated and transferred to the Netherlands for advanced medical treatment. To control the situation, wearing masks on board has been made mandatory. In addition, the use of personal protective equipment (PPE) has been instructed for those who have come into contact with suspected patients. Hantavirus is mainly spread through rodents or rodent-like animals. Humans can become infected when saliva, urine or feces from infected animals or dust from their habitants enters the body through inhalation. It does not typically spread directly from person to person. However, in a rare strain known as the Andes virus, limited human-to-human transmission has been observed. In the early stage of infection, symptoms usually include fever, fatigue, muscle pain and headache. Later, more severe complications may develop, such as coughing, shortness of breath and fluid accumulation in the lungs. In some cases, the kidneys can also be severely damaged. According to experts, Hantavirus has 2 main types. One affects the lungs, known as Hantavirus pulmonary syndrome, and can have a mortality rate of up to around 40%. The other is more commonly found in Europe and Asia and mainly causes complications in the kidneys. At present, there is no specific vaccine or definitive treatment for this virus. Patients are generally treated based on their symptoms, and in severe cases, oxygen therapy or ventilator support may be required. Experts say there is no need to panic, but caution is important. They note that the risk of infection can be significantly reduced by controlling rodent infestations, maintaining proper hygiene, and taking safety measures in high-risk areas. The World Health Organization has stated that it is closely monitoring the situation, and so far, there is no indication of a large-scale pandemic.